The decision to proceed with rotator cuff surgery can be stressful, and having a good understanding of that process can really help alleviate some of that stress. So in this video, I'm going to cover that process, really from the time that we decide to proceed with surgery up until the actual day of surgery itself. The overlying principle here is that we want to set you up for success, both in terms of the surgery and your healing potential, as well as the rehab experience. So beginning with the surgery, we first and foremost want to identify any associated pain generators that you have in addition to the torn rotator cuff. So it's not uncommon for patients to have injuries involving the labrum, the cartilage, sometimes the biceps tendon, as well as areas of bone spurs or arthritis. So we want to identify those and really address them all at the same time. The next component is optimizing your healing potential. And that begins with identifying any risk factors that you may have that will impair your healing ability afterwards. So that might include use of tobacco products. It might include any sort of other medical conditions that require medications that have to be discontinued temporarily, things of that nature. A third component to that is that in select cases, we may discuss the option of optimizing your rotator cuff repair with a biologic. Okay, so the use of platelet-rich plasma or PRP, and on rare cases, use of stem cell treatments as well. The next component is setting you up for success in terms of the rehab experience. So first and foremost, we want to make sure that the surgery fits into your life. You know, there are pretty extensive restrictions that go along with that process. We're often putting you in a sling for up to 6 weeks. We may not let you lift or strengthen the rotator cuff for up to 3 months. And we also need to make sure that you can participate fully in the rehab requirements, and that may include twice-a-week rehab for up to 6 months. So identifying any barriers to those requirements ahead of time, I think is very important. Following that, we have you meet with my surgery scheduler, and she's going to cover a variety of things, including insurance authorization. She'll actually do the surgery scheduling herself. She'll fit you for a sling. She'll discuss sort of perioperative pain management, and that includes use of an ice machine. She'll give you postoperative pain med prescriptions at that time. She'll also give you our surgery packet, and that covers a lot of this information. It goes over the surgery in detail and provides research articles on various topics as well. The next component is medical clearance. So some patients will require a visit with a primary care provider. And really the principle there is that we want you to be safe and the best version of yourself at the time of surgery. Sometimes that involves obtaining labs and other diagnostic tests to ensure that that's the case. The next component is the ambulatory surgery center. There's a pre-anesthesia team that will call you prior to the surgery to review your medical conditions and really cover that perioperative process, just to make sure that, again, you're set up for success from an anesthesia standpoint. Also, they will typically discuss use of a regional anesthetic, which I often use in addition to the general anesthetic. And so essentially what that means is this. You'll be completely asleep during the surgery, but in addition to that, we will often give you a regional anesthetic that will numb your arm for at least 12 to 24 hours and occasionally 3 to 4 days, depending on the details of the surgery. In addition to that, the surgery center is going to give you some basic logistics, where to park, where to check in. They'll let you know certainly the date of the surgery, but also what time to arrive. And then, of course, on the day of surgery, you will arrive. You'll check in. We'll take you back to the preoperative area, and they'll set you up with an IV. They'll check your vitals, and you'll meet a variety of staff, including the nursing staff, the anesthesia team, and myself. And at that time, we'll cover the overall process. I'll let you know what to expect, again, on the day of surgery and going home. We'll discuss the regional anesthetic again, and it's typically provided prior to you actually having the surgery. So the anesthesiologist will give you an injection into your neck or place a catheter into your neck and go over all the risks of that at that time so that you can decide whether or not that's something you want to proceed with. And then we proceed with surgery. I anticipate we'll do another video here covering the post-operative process up until your first follow-up visit, so stay tuned for that. Hope this helps.